My, it's a beautiful world. I like swimming in the sea.
We're here at NYU School of Medicine covering the conference of CSAAH, which is the Center for Asian American Health. And I'd like to ask our newfound friend, Feli, Miss Felicitas de la Cruz, about the conference today and how exciting it is that we're actually discussing things about Asian Americans. And apparently, we're finding out that there are not much records, data about health disparities here in North America. In America, or especially here in North America. Meron po kayong, would you like to give your insight and your excitement about these things that everybody's talking about now?
Well, I am just delighted that there is this Center for the Study of Asian American Health in New York, and I think this will be the seed for a broader network of centers for Asian health studies. I think it's long overdue, and I'm just happy that New York University has done this wonderful and impressive project. And I do hope that it will reap so much success and it will really redound to better and improved health for Asian Americans.
Tell us rin ho about your studies. So apparently you're also in the studies of cardiovascular disease, and as Filipinos here through Project Aspire and Kalusugan Coalition are also getting into that and trying to find out what are the reasons why CVD is the #1 killer of Filipinos here and abroad.
Well, when I was on my postdoctoral study at UCLA, I was delving into the literature to find out what are the needs of Filipino Americans here in the United States, and to my amazement, there was hardly any available literature there. And so I just read through it, and some of the studies in California way back in the 70s and early 80s show that hypertension is so high in its prevalence among Filipino Americans, and stroke is one of the major cause of death among Filipinos, both for men and women. And so that generated the interest for me to look at hypertension. And so I started out developing a short acculturation scale for Filipino Americans, and I am honored that the Project Aspire is using this measure, this instrument, in their studies to determine the acculturation of the Filipino Americans who are participating in this project. Also, I have just also completed a small pilot study in Los Angeles to determine the factors that are involved in the control of hypertension among Filipino Americans there. And I found several factors that emerged from the focus groups that I found. And of course, the Filipino Americans who participated in this study said that one of the reasons is that our diet is high in salt and high also in fat. For the most part, Filipinos with high blood pressure are very knowledgeable and aware of their conditions. But a lot of our cultural practices, for the diet particularly, is one factor that they say it's very difficult to just give up on the foods that we have been accustomed to. And I can understand that these are comfort foods, but I think that we need to get started really in making sure that many Filipino Americans should really become aware of the bad effects of high salt and high fat diet. So that's one of the areas that I think healthcare givers need to really focus their attention on. And I know it's difficult, but every project starts with the first step.
First step. course, we also found out that in the Chinese community here, they've gone a step above that, and they've actually gone to different restaurants and telling them, is there a way that we can change your way of cooking? The less salt, the less this, and the less that. Have you? I know you guys are far in advance in California, and have you had projects yourself or other people who have projects like that, who have gone to communities, especially restaurants, and pleading to them to, cook less salt and less fat?
Well, I know that many organizations have tried doing that, but I don't know if there has been any documentation as to the effects of these projects. So, and that is one of the things that I think we should be aware of, is that whatever interventions we do, we should really see to it that we can document the effects of these projects so that it will show success and we can build on those successes so that we can also further get more support for additional studies.
In the future, yes. Maraming salamat po. Thank you very much.